Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Chronic pancreatitis and its clinical features. So first, let's see the most common symptom. So the most common symptom is going to be the abdominal pain. It is the abdominal pain, and let's look at the site. So in terms of the site, it is if the infections are in the head of the pancreas, if infectious foci they are present in the head of the pancreas, so it is present in the head of pancreas, so then the epigastric and the right subcostal pain is common. Then in such cases, the epigastric as well as the right subcostal pain, so epigastric and right subcostal pain, this is common. And if the infection is limited to the left side of the pancreas, the infection is in the left side of the pancreas. So in such cases, the left subcostal and the back pain are seen. So the left subcostal as well as the back pain they are seen. So it is precipitated by the food intake. It is precipitated by food intake, and weight loss is also seen. The weight loss is seen. This may be associated with the nausea as well as vomiting. So there can be nausea as well as vomiting. Now looking at the exocrine insufficiency. So here it precedes the endocrine insufficiency. It precedes endocrine insufficiency, and it correlates with the morphological changes. It correlates with the morphological changes and manifests with the malabsorption syndrome symptoms. That is, it includes the steatorrhea as well as the diarrhea. Next is there is manifest with the signs and symptoms. And this is of a fat soluble vitamin deficiency. Vitamin deficiency, and this includes it can be bleeding, it may be osteopenia as well as osteoporosis. Next is there is endocrine insufficiency. So in terms of endocrine insufficiency, it is going to be the diabetes mellitus. To learn and grow daily like this, please do subscribe.